So why did California, which was the golden child of the pandemic response in the spring, become the epicenter of the disease in the winter? And did the ban on outdoor dining make matters worse? With us is Dr. Monica Gandhi, a professor of infectious disease at the University of California, San Francisco School of Medicine. So, doctor, what do you think?
I think there are three hypotheses for why this happened to us. One is that actually we may have been more strict about lockdown than any other place. And it was a very prolonged period of time, and different counties did it to certain degrees. And that may have exhausted people because it's not just exhausting, of course, socially, that people need to see each other for harm reduction purposes, but also just that economically it was so difficult for people. And so it may have been that people started not listening to public health officials so much at the end. The second is that we may have a more transmissible strain. We're looking into this. This is the L452R strain, and it's being examined if it was more transmissible. And the third is that we likely did not protect our essential workers to begin with, as well as some other places. You can protect them in two ways. You can either keep things that can be kept open so that they have a way to put food on their table, or if you're going to close them, then you give them financial support from the city or state while the federal government was not doing their workings as hard on the stimulus package. So those are the three reasons that have been invoked.
Well, the mayor of Chicago recently asked restaurants in that city to reopen indoors, not because COVID cases have declined, but to help stop transmission. People are demanding social interactions and that a regulated restaurant space will keep them from unregulated and more dangerous gatherings at home. Here we don't even have outdoor dining. Was that a mistake?
I am also concerned about what you just said, because by definition, outdoors is safer. It's actually 20 times safer than inside. There's been meta-analyses, so that's how much we want to encourage outdoor. Saying that everyone stay away from each other for 11 months is not conducive to how humans are. That it's human behavior and desires to also need to see each other. It's a very human need. It's not, there's nothing, that you're denying COVID, just people need to see each other. And so the idea that you close places that are safer will make people and can make people then go inside, where by definition it's less safe. Even if they mask, if you drink, people can take off their mask. It's just a less safe environment. So I've always been in favor of keeping the outside safe places open. That would include outside dining, and no other states have restricted outside dining. Inside dining has more data behind it, but this was the state that said no outside dining, and we have better weather, so I think it was a fair point. Was there a specific scientific rationale for the move? So there is not data on outside dining that I'm aware of that it drives risk. There was two models that showed that dining, one was from the CDC that showed that dining can drive risk because you have to take off your mask, but they didn't distinguish between indoor and outdoor. And then there was a Chicago model published in Nature that said it was inside dining in particular. So there wasn't data, and there hasn't been data that I'm aware of, that outside dining with the ventilation, with the masking, distancing, and hand hygiene, so keeping people apart, was driving this risk. I think it was more, let's just close everything. And I do understand that we wanted to try to mitigate risk, but we don't want to do unintended things that can drive people inside. And that's, I think, my concern as someone who studies human behavior, because I'm an HIV doctor, and we study human behavior along with our straight up virus.
We should point out, though, that most specialists support the crackdown on outdoor dining. It's not just LA County. But your point is, it's not just the virus you need to look at, it's how people behave and navigating the very human need for social interaction.
Yes, when we look back on this time, I think we will say that, of course, we want to mitigate transmission. And in fact, any harm reductionist, I'm not someone who believes in harm reduction. Harm reduction is the idea that you make your decisions for public health based on the fact that people know how to stay safe, I agree with you.
Dr. Monica Gandhi, MD and Professor of Medicine at the University of California at San Francisco, thanks for taking the time.
Thank you.